This is Essentials of Pharmacology for Health Professions, 9th edition, Chapter 13, Autonomic Nervous System Drugs. Please keep in mind that this is a summary of the chapter and you will need to read the ebook or your textbook to further enhance your knowledge of the chapter. Chapter Objectives. Upon completion of this chapter, you should be able to describe the sympathetic and parasympathetic nervous systems, contrast the 4 categories of autonomic nervous system medications, list the most frequently used or key medication in each of the 4 categories and the purpose of their administration, describe the possible side effects of each of the key medications, and relate patient education concepts that pertain to the 4 categories of autonomic nervous system medications. Autonomic nervous system. It's important to understand how the autonomic nervous system works in order to help you with the chapters that will be coming up, such as respiratory, cardiovascular, and urinary. And these chapters also use autonomic drugs to treat diseases and conditions. The nervous system is comprised of 2 systems. You have the central nervous system, or the CNS, which consists of the brain and spinal cord, and the peripheral nervous system, or PNS, which is all the nerves that lie outside of the brain and spinal cord, and it connects the rest of your body to your brain and spinal cord. As you see in figure 13.1, you see how the peripheral nervous system is divided into the brain and spinal cord, and then which is the central nervous system, and then you have your outlying nerves, which is the peripheral nervous system. And there's 2 branches of the peripheral nervous system, which consist of somatic branch. This is the one that consciously controls skeletal muscles. And then you have the autonomic, which unconsciously controls smooth muscle, cardiac muscle, and the glands. The purpose of this chapter, we'll talk about the autonomic nervous system. The autonomic nervous system is referred to as being automatic, self-governing, and involuntary. It is further divided into the sympathetic and parasympathetic nervous systems. As you can see in the image, the parasympathetic system, this is your rest and digest system. And the sympathetic system, we can think of that as our fight or flight system. We'll discuss these in further detail on the next few slides. The sympathetic nervous system is your alert system that quickly prepares your body to face emergencies. It automatically alerts to cause physiologic responses to prepare you for fight or flight. These responses can include pupil dilation, inhibits salivation, relaxes bronchi, increased heart rate, slows digestion, reduces intestinal muscles, adrenaline production, and reduces blood flow. As you can see the image on the right, the sympathetic nervous system, just as described, what happens in the body when your fight or flight system is alerted. For this system, we will use sympathomimetic or adrenergic drugs, and these are the ones that mimic these responses. The parasympathetic system can be thought of as the body's resting and digesting system, which helps to maintain the normal body functions without any conscious effort. Chemical substances called neurotransmitters are released at the nerve endings within these systems to transmit nerve impulses from nerve to nerve at the synapses or from nerve to smooth muscle, cardiac muscle, or glands. The following are parasympathetic reactions: pupil constriction, stimulated saliva, bronchoconstriction, slow heart rate, stimulates production of bile, stimulates digestion, intestinal muscle relaxation, and causes an erection. As you can see in the image, figure 13.2, this contrasts the peripheral nervous system and sympathetic nervous system physiologic responses. They work in opposition to balance each other. This image is showing the parasympathetic and what happens in the body to these responses. As you can see, this also brings back the body back to homeostasis, which is opposite physiologic responses from the sympathetic nervous system. Drugs that are used to mimic these responses are your parasympathetic mimetic or cholinergic, since acetylcholine is the neurotransmitter substance in the peripheral system that causes the response. Knowledge check 1. Which is not a sympathetic nervous system reaction? Choose from the following choices. Write your answer down. At the end of the video, there will be a slide for you to be able to check your answers. Now we will look at the 4 categories of autonomic nervous system medications. These are based on whether they stimulate or mimic or block, lytic, the response of the sympathetic or parasympathetic nervous system. They include adrenergic or sympathomimetic, which is that they mimic the sympathetic responses, adrenergic blockers or sympatholytic, which block sympathetic responses, cholinergic or parasympathomimetics, and these mimic parasympathetic responses, and the cholinergic blockers, which are also called parasympatholytic, which block parasympathetic responses. Knowledge check 2. Which category of the autonomic nervous system blocks sympathetic responses? Choose from the following, write down your answer. You can check at the end of the video. Adrenergics. Remember, adrenergics mimic the action of the fight or flight sympathetic nervous system. This system has several types of adrenergic receptors that cause specific responses. Refer to Table 13.1 for the type, where found, and response when stimulated for these adrenergic receptors. Learning hint in your book or ebook will help to distinguish the alpha and beta receptors. If you look at Table 13.1 here, adrenergic receptors. Now, note there are additional adrenergic receptors, but these are the main ones to concern ourselves with for this chapter. You see the type is alpha. You have alpha, and they are found in blood vessels in the pupil. What response is it when they're stimulated? Vasoconstriction. This reduces blood flow and increased blood pressure, and it dilates the pupil. This is termed mydriasis. You have the beta 1. They're found in the heart, and these increase the rate and force of contraction. Beta 2. They're found in the airways of the lungs, and their response is bronchodilate. They open up the bronchi. Adrenergic medications. The neurotransmitters released at the sympathetic nerve endings are called catecholamines and include norepinephrine and dopamine. Epinephrine is the hormone secreted by the adrenal glands in response to strong sympathetic stimulation. The chart below lists actions, uses, side effects, and cautions or contraindications of the adrenergics. Actions is cardiac stimulation, increased skeletal muscle strength, peripheral vasoconstriction, bronchodilation, and dilation of the pupils. Their uses are restoring rhythm in cardiac arrest, elevating blood pressure in shock, elevating it, constricting capillaries, dilating bronchioles in acute asthmatic attacks, bronchospasm or anaphylactic reaction, and ophthalmic procedures. There are some side effects. Cardiac side effects associated with increased heart rate and blood pressure, nervousness or tremor, hyperglycemia, tissue necrosis. There are some cautions and contraindications with angina or chest pain, coronary insufficiency, hypertension, cardiac arrhythmias, angle closure, glaucoma, hyperthyroidism. A caution with dose and route of administration. You want to definitely check your dosage carefully, and these should be given sub-Q, IM, or IV, which is intravenous. This table, which is table 13.2 in your ebook, is the representative adrenergic medications or receptors, their uses, side effects, and contraindications. Medication name, epinephrine. This is an injector or injected. It can be like the EpiPen. It's used for bronchospasms, asthma, and cardiac arrest. There are some side effects, which include cardiac side effects associated with increased heart rate and blood pressure, nervousness or tremor, and hyperglycemia. Dopamine is another one of these. They're used to raise blood pressure, cardiotonic. Side effects are the same. Isoproterenol, this is for heart block or ventricular arrhythmias. Also, side effects are the same. And norepinephrine, this is for acute hypotension and severe shock. Side effects are the same with this as well. Be sure to read patient education throughout your chapters. Let's use the critical thinking and answer the case study activity. An adult male attending a baseball game suddenly felt a sting on his left arm and realized he was stung by a wasp. He has a severe allergy to bee stings and instantly began noticing difficulty breathing and closing of his airway. Which medication would be the first line of treatment? Choose from the following, write your answer down, and your answer will be revealed on the next slide. If you answered epinephrine, you are correct. Remember, epinephrine is used for bronchospasms, asthma, and cardiac arrest. This would be the first line of treatment for this case study scenario. Now let's look at the adrenergic blocker medications. The following table shows the various adrenergic blocker medications, their uses, side effects, and contraindications. Remember, adrenergic blockers or sympatholytics work against the sympathetic responses. Most commonly used are the alpha and beta adrenergic blockers or alpha blockers and beta blockers. The first one there is a beta blocker, which is propranolol. It's used for blood pressure control or hypertension, angina, which is using the low dose, cardiac arrhythmias, migraine prevention, and tremor. Side effects would be hypotension, bradycardia, fatigue or lethargy, bronchospasm, nausea and hypoglycemia, and confusion. The other medication you have there is metoprolol tartrate. It's a beta blocker as well. It's used to treat hypertension. Side effects are the same for this one as well. The following are also adrenergic blockers, and they include the metoprolol succinate, which is a beta blocker. It's used to treat hypertension. Side effects are the same as well for the next two as well. Doxycycline, which is an alpha blocker. It's used for hypertension and benign prostatic hyperplasia, or BPH. Tamsulosin, which is an alpha blocker, and it's used for BPH, or benign prostatic hyperplasia. Side effects are the same for all three. Now let's check 3, which represents a commonly used adrenergic beta blocker medication. Choose from the following, write your answer down, and you'll be able to check at the end of the video. Now let's look at the cholinergic or parasympathomimetics and their uses, side effects, and contraindications. Remember that these medications stimulate or mimic the parasympathetic nervous system. The first one you have in the chart is bethanechol. It is used for postpartum or postoperative urinary retention, not with BPH or benign prostatic hyperplasia. Cevimeline, this is for xerostomia, which is dry mouth. Side effects are the same for these medications: nausea, vomiting, diarrhea, muscle cramps, and weakness. slowing of the heart and hypotension, sweating, excessive salivation, lacrimation or discharge of tears, flushing, respiratory depression, and bronchospasms. Here are a few more cholinergic medications to review, and these are on table 13.4 in your ebook. These include neostigmine, which is used to lower intraocular pressure in glaucoma. Pilocarpine is used to treat xerostomia or dry mouth. Pyridostigmine is used primarily for the treatment of myasthenia gravis. Side effects are the same as I discussed earlier. Now I'll discuss the cholinergic blockers or parasympatholytics, which are the drugs that block the action of the parasympathetic nervous system. Below is a table that lists these cholinergic blockers or anticholinergic medications, as they're called as well, their uses, side effects, and contraindications. Atropine is one of these. This is the only one that acts as a bronchodilator, and it's the most common eye drop. In your ebook, you can see the clinical application regarding eye drops and atropine. It is used for preoperative for bradycardia, which is slow heart rate. The next one is scopolamine. These are in patches, and they are commonly used anticholinergics. They're used to prevent motion sickness, reduce salivary flow. And then you have homatropine, which is a mydriatic. Side effects of these medications include fever or flushing, blurred vision and headache, dry mouth, constipation, urinary retention, falls, delirium, and cognitive impairment, especially in older adults, and palpitations and tachycardia, which is abnormally fast heartbeat. They're all the same for these medications. Some additional cholinergic blockers are dicyclomine, which is used for irritable bowel syndrome, vesotretine, which is for overactive bladder, and oxybutynin, which is for overactive bladder. Again, side effects of these are the same. Please review these in your ebook on table 13.5, representative cholinergic blockers. Remember, the cholinergic blockers or anticholinergics block the action of the parasympathetic nervous system. The parasympathetic nervous system is normally producing secretions and performing digestion. Blocking these functions causes decreased secretions and decreased GI motility. This table just sums up what I previously discussed in the earlier slides. It shows their actions, uses, side effects, and cautions or contraindications of the anticholinergics. The actions are drying. All secretions will decrease. Decreased GI and genitourinary or GU motility, and dilation of the pupils. They're used for antispasmodics and antisecretory for GI or GU hypermotility. They're used as a pre-op and pre-anesthetic. They are used as an antidote for insecticide poisoning, cholinergic crisis, or mushroom poisoning. They're also used for emergency treatment of bradycardia, slow heart rate, and atrioventricular heart block with hypotension, dilation of pupils or mydriatic, and prevention or treatment of bronchospasm. Side effects: fever or flushing, blurred vision and headache, dry mouth, constipation and urinary retention, falls, delirium and cognitive impairment, especially in older adults, palpitations, and tachycardia. Cautions and contraindications, there are several, so review in your ebook for those. Knowledge check 4. Which is not a possible side effect when using the cholinergic blocker atropine? Choose from the following, write your answer down, and you'll be able to check it at the end of the video. This slide provides important patient education on 2 of the 4 autonomic nervous system medications, adrenergic receptors and blockers. This information is also found throughout your chapter after each section in your ebook or your textbook. This slide is patient education on the cholinergic and cholinergic blocker medications for the autonomic nervous system. Again, this information is found in your ebook or textbook. Knowledge check 5. Which represents patient education you would provide to a patient using a cholinergic blocker medication? Please choose from the following and write your answer down, and you will be able to check it at the end of the video. Now check your answers. This slide provides knowledge check activity answers 13.1 through 13.5. Now it's time to assess yourself. Answer the following questions. Write your answers down to see what you learned in this chapter. Learning hints, clinical applications, and patient education. Please review the helpful learning hints, clinical applications, and read patient education in your chapters, as these will enhance your knowledge of the different medications. It's also recommended to answer the review questions after each chapter. This concludes Chapter 13, Autonomic Nervous System Drugs.